first I have to define what is the highest and best use of my time, right? And so that again is leadership. So we don't want the dentist doing things that somebody who is talented and credentialed can do outside of him. That's number one, right? So in other words, what can he or she move over to somebody who's not the dentist themselves? And then it's focusing on what are the things, again, that are going to drive the highest revenue. And I don't think so much, these folks are typically very good at time management. They've studied for dozens of years and they know how to manage a 12 or 14 hour schedule. Where a lot of folks sometimes miss the mark is, what should I be doing? So I don't think it's an issue so much of how do I fit all this in. It's, for example, a quick story of the big rocks. So there's a professor who tells the story of the big rocks, and he takes a mason jar, fills it with water, and then drops in the big rocks, and he says, is the jar full, right? Secondly, and of course the students say, yes, of course the jar is full. Secondly, he puts in some sand. And then last, he puts in the water, and he says, what's the lesson here? And they say, you can always be better at managing time. You can always put more into your schedule. And he says, no, the only way it works is if you put the big rocks in first. And so what the practitioner has to establish and understand, the big rocks are those treatments and procedures that drive the most revenue and keep the folks coming back.